Okay, I'm going to check the scene to make sure that it's safe for myself and my crew. I have BSI on. I'm taking a look around, and as I assess the scene, I see what appears to be one patient. I don't see any others. I don't see any need for additional assistance or equipment or other apparatus at this time. Do I have any bystanders that I can get any sample history from? Okay, so I'm going to form my general impression. Looks like I have an early 30s, late 20s male patient, trauma, looks fairly severe, doesn't seem to be moving at this time. I'm going to have one of my assistants come and take manual stabilization of the C-spine, and then I will come in and enter. And I'm going to assess to see if there's any response at all. Does it respond to any verbal stimulus?
Unresponsive.
Okay, so I'm going to now check and see if there's any painful stimulus or response at all. Is there any response to pain? Okay. At this time, what I'm going to do is come and assess the airway. So I'm going to do a modified jaw thrust, and I'm going to look, listen, and feel. Is the patient breathing at all?
You hear snoring.
Okay. And do I have a rate, rhythm, and quality that goes along with this?
Respiration is 36, shallow and rapid.
Okay. So his airway is not secured at this time. What we're going to do is measure and insert an OP and a couple of NP airways. Does he accept? All right, so the airway is secured at this time. His respirations are a little bit fast, so I'm going to have my assistant take a bag valve mask, and we're going to bag the patient at a rate of 12 to 20 breaths per minute with 15 liters and 100% oxygen with the bag valve mask. Is he having any difficulty with that, or is there any reason to suction the airway?
No reason to suction.
Okay, so he's going to maintain that airway from there. I'm also going to just take a look at the neck for any JVD or tracheal deviation associated with the breathing. Do I see any of that? And I'm going to expose the chest as part of my breathing as well and quickly assess, do I see anything with the chest at all?
Bruising of the left lateral chest with deformity and crepitus.
Okay, and there is crepitus there. So I'm going to note that. So I seem to have cleared my airway. What I'm going to do now is check for circulation, my pulses. I'm going to check central and peripheral pulses. Do I have a pulse?
Weak and rapid.
Okay, and do I have a rate with that?
140.
All right, so I'm going to note what the pulse rate is and that it's weak and rapid, but I have airway, breathing, circulation, and what I'm going to do is check for hemorrhaging right now very quickly, and I'm going to be checking my gloves. Do I see any blood at all as I'm assessing the patient?
No.
All right. Check down the legs and down the arms, so no severe bleeding. And at this time, I'm going to take a look at the patient's skin color, temperature, and appearance.
Pale, cool, and moist.
Okay, so based on my initial assessment and the information I've gathered, I'm going to determine that this patient is a high priority and that we need immediate transport at this time. I am going to notify a trauma team. I'm also going to pick up a paramedic intercept on the way. I'll have my dispatch take care of that. I'm going to send one of my other assistants to get a longboard and a collar for some extrication. I'm going to start my primary assessment. So I'm going to start at the head, and do I feel any decap BTLS at all as I'm assessing? And I'm checking the posterior or on the neck. Do I feel any step-offs or any deformities or any pain that's noted at all there?
No.
Do I have any change with the JVD or tracheal deviation, or is there a stoma around the neck or anything?
None.
So as my partner gets here, we will appropriately size and place a collar. The airway is still being controlled and secured. I'm going to assess the shoulders one at a time together, and I'm going to push down on the sternum. Does that appear to be intact? Okay, and I'm not going to push in on this side of the chest, but I am going to try and check for integrity of the chest wall elsewhere. Do I have any other issues at all with the chest that I've can find?
You have just your deformity and crepitus, the bruising.
Okay, and do I have equal expansion of the chest as the patient is being bagged?
You have decreased lung sounds on the left.
Okay, so I have a decreased movement here. I'm going to check my lung sounds now that I'm here at the chest. So I'll put my ears in, and I'm going to auscultate here. And what are my lung sounds on this side?
Decreased lung sounds on the left.
Okay, so nothing. The right side is clear then, I'm presuming? All right. And I check, so I don't have anything else. What I'm going to do at this time is I'm going to assess the abdomen. All right, I'm going to check sort of the retroperitoneal side. Is there any wincing or pain or anything noted there?
None.
I'm going to push in on the pelvis. Is there any crepitus noted or deformity?
Stable.
Okay, I'm going to expose the lower extremities right now. Upon inspection, do I see anything?
Left upper femur swelling, deformity, and discoloration.
Okay, so I'm going to sort of skip over from palpating that area, but I am going to sort of note the size, and I'm going to check the rest of the leg on the way down. Do I have distal pulses present at all past this injury?
No detectable pulse in left leg or foot.
Okay, and I'm going to check the right side here all the way down. I do note that there is a difference in the size of the femur area. Do I note anything on this leg at all?
Weak, thready pulse.
Okay, and I do have pulses, which is great. So now I'm going to finish exposing the rest of the patient on the arm. I'm going to check this right arm here, and do I note anything on this arm at all?
No.
And I'm checking for a pulse. Do I have a pulse on this side distally?
140, weak.
Okay, and I'm going to finish exposing this arm here as well. And as I assess, do I find any injuries on this arm?
No.
And is there a pulse on that arm as well?
It's weak, 140.
My long board is here. What we're going to do is we're going to roll the patient up towards me so that we don't roll on any of the injuries. And on the count of 3, 1, 2, 3. And I'm going to quickly assess the posterior of the patient. Is there anything of note there?
Unremarkable.
Okay, we're going to roll the patient back onto the board. We're going to secure them so that we can get him off from the scene. And now we're going to move off from the scene and into the back of the ambulance and begin transport. At this time now I'm going to start my secondary assessment, and again I'm going to start up at the head, but this time in much more detail. I'm checking the orbits, I'm checking the nasal bones, I'm checking the mandible, the maxilla. Do I find any issues there at all?
Pupils are unequal.
Okay, so I'm checking the pupils now, and so the pupils are unequal. And are they responsive to light at all?
Unequal and non-reactive.
Okay, and I'm looking in the ears and also behind the ears. Do I see any fluid at all, or do I find any battle signs or bruising at all?
No.
All right. I'm going to take a look through the collar because I have that on. Has the JVD or tracheal deviation gotten worse at all?
No.
And do I have any medical alert tags around the neck?
No.
All right, I'm going to check again the shoulders, the clavicles, one at a time, then together. Check the scapulas as well. Do I have any issues there?
No.
And I'm going to reassess the chest, still making sure that it's intact, not pushing in on the crepitus or deformed area there. And I'm going to take out my stethoscope again. I'm going to reassess the lung sounds. Have I had any change in the lung sounds since the first time?
No.
Okay. I'm going to reassess the abdomen to see if there's been any change in the condition with the patient. Has the abdomen different at all?
No.
And again, checking retroperitoneal, pushing in on the pelvis, not pushing down. Now that we have the patient in the back of the truck, I'm going to have one of my assistants take care of this femur fracture. We're going to apply a traction since I've discovered no other injuries either on the hip or anywhere else on the lower part of the leg. Does that seem to help with the femur? Do I have any pulses that are reestablished distally now?
Pulses are the same.
Okay, and I'm going to ask the patient if he can push down, if he can pull up, if he can wiggle his toes. I do check for pulses and sensation, and I also will check a Babinski reflex. I'm going to come over on this side. I'm going to reassess the right leg here as well. Do I have any changes there?
None.
So I'm checking for pulses, cap refill on this side as well as the other. Can he push down? Can he pull up? I'm going to check a Babinski reflex, and I'm also going to look for any medical alert tags that may be down on the ankles. Do I find any?
No.
So now I'm going to assess the upper extremities, this right arm once more here. Do I find anything with this arm?
No.
Checking for a pulse to make sure that it's still present. Checking for tenting, for dehydration. I ask if he can squeeze. I check capillary refill. I look for any medical alert tags. Do I find any?
No.
At this time, I'm going to take my cuff. I'm going to apply this to the patient since I know that there are no injuries to this arm now. And I'm going to assess the patient's blood pressure. And what do I get for a pressure?
80/56.
Okay, so I'll have that noted with the remainder of the vital signs. I'm now just going to finish reassessing the other upper extremity. And again, I'm going to check to see if there are pulses present, see if there is tenting, see if he can squeeze, capillary refill, see if there's any medical alert tags. Do I find any there?
No.
Okay. I'm going to continue to reassess this patient every 5 minutes with vital signs. I am going to cover him with a blanket. We'll also use a glucometer, check his blood sugar, and we'll put him on a 12 lead and get that information for the paramedic when they arrive.